I gave my permission for this video to be filmed.
Hello, my name's Haley. I'm going to be your nurse today. Can you please tell me your name and your date of birth?
Allison Hayes, 10699.
Okay, so today we're going to be performing an assessment of your heart and your neck. I'm going to start out by assessing your heart. First, I'm going to listen to your apical pulse for the rate and the rhythm, listening at the PMI, which is the point of maximal impulse, or where your beats can be heard the loudest. Okay, so your rate was 82 beats per minute, which falls within the normal range, which is 60 to 100. And your rhythm was also even and normal, or regular, which is also good, what it's supposed to be. And now I will listen in 4 other places, once again. First place I will listen is the aortic. Second place is the pulmonic. Tricuspid. And the mitral. And those were all even and normal as well. So now we can move on to your neck. Well, first I should ask, did you have any questions or concerns about anything with your heart?
No.
And did any of that hurt?
No.
Okay, good. So now we can move on to your neck. And let me know if anything is tender or painful during this, because I will actually be palpating, which is pressing with my fingers. So first I will look for the symmetry in your neck. So everything looks symmetrical. There's no protrusions, no lesions. Everything looks nice and good. So now I will test your symmetry of your neck movements and your range of motion. So I'm going to ask you to look to your right and now look to your left. So that was both even. So now I'm going to ask you to do that again, but with resistance from my hands. So just look to your right, look to your left. Okay, good. So next we will test your cranial nerve 11. I'm going to ask you to shrug your shoulders up against my hands against resistance. Good, that was all even. And then now we can move on to your palpating and auscultating your carotid artery one at a time. So I'm going to start with this side that I'm on right here. I'm going to palpate it first. It's palpable. Feels like even, normal, +2. Now we'll auscultate. Sounds normal as well. Now we'll do them both. I'll do your apical and your carotid at the same time. Make sure there's no discrepancies, and there wasn't. So now we'll check the other side. Auscultate first, or palpate first again. Now auscultate. Now at the same time again. And those were all even and normal as well. And they were even bilaterally. So next I will palpate your trachea. Any tenderness there?
No.
So that's all even and normal there. Your trachea. And now I will do your thyroid gland. Any tenderness there?
Mm-mm.
Okay, that's not enlarged at all. It's normal. And now I will do your jugular vein. Any tenderness there?
Mm-mm.
So that's even and normal as well, no swelling or tenderness. And then we will do your lymph nodes. So your jugulo-digastric, any pain there?
Mm-mm.
Your superficial cervical, any pain there?
Mm-mm.
Your deep cervical chain, any pain there?
No.
Your posterior cervical, any pain there?
No.
And then your supraclavicular, any pain there?
No.
Okay, well that completes your heart and your neck assessment. You have any questions about anything that we did today?
No.
Okay, well everything that we did today was like normal and what it's supposed to be. So we didn't find any abnormalities or anything. So we don't need to see you again for another year for your annual checkup unless you have any problems. Come see us again.
Okay.
Thank you.
Thank you.